The next speaker is going to talk about functional medicine, and his name is Dr. Kenneth Litwin, MD, who received his medical training at Hahnemann University School of Medicine, now Drexel University School of Medicine, and subsequently completed his residency in primary care internal medicine at Yale University School of Medicine in 1999. He currently practices outpatient primary care and general internal medicine as part of a small group private practice affiliated with Danbury Hospital. He also practices functional medicine in Sandy Hook. Dr. Litwin serves as Section Chief, Division of Outpatient Medicine at Danbury Hospital. He is a member of the Board of Trustees of the Fairfield County Medical Association and is a member of the Connecticut State Medical Society. Dr. Litwin received his training in functional medicine from the Institute for Functional Medicine and earned his IFM certification in 2016. Thank you very much, Ken, for being with us.
Thank you, Mark. And thank you all for being here, and I hope I can educate you about how functional medicine can help us to deal with the burden of chronic disease that's going to bankrupt us all. So my name, once again, is Dr. Ken Litwin, and I practice internal medicine, primary care in Danbury, and I've been doing that for about 16 years. But about 2 years ago, I began to get sort of frustrated with my ability to provide care for my patients with chronic illnesses. I wasn't getting as far as I would have liked to. And I happened to be introduced to functional medicine from my friend Dr. Trowbridge here, and my life hasn't been the same ever since as far as my career and my personal health. Okay, so an economic group at Harvard calculated that over the next 20 years, the world economy will spend $47 trillion. That's a lot of money on some non-communicable diseases, which are basically non-infectious diseases. And you know them all very well: diabetes, cancer, cardiovascular disease, and chronic lung disease like emphysema, COPD, and asthma. And Department of Health and Human Services in the United States determined that over 70% of all deaths can be attributed to those diseases that I just mentioned. Connecticut is, of course, no different. And I'd like to use this slide from the World Health Organization just to illustrate that we are spending all of our money in the worst possible way in the end stage of these diseases. And, you know, that just can't go on. There's not much more cost savings that we can squeeze out of that group. If we just took a drop of what we spent on that stuff and spent it on this stuff, which is the lifestyle changes, diet, exercise, orthotics, etc., we would be in a much better shape. Now, I don't know how it is when you go to your doctor, but most people, when they go to the doctor, their doctor says, yeah, you should, you know, fix your diet up and exercise. But do they really stress it? I mean, are they saying you should do it or you must do it? So I'm saying that doctors need to start telling patients that they must make these changes, or else they will get one of those chronic diseases. However, doctors are unfortunately not well versed in preventive medicine, especially nutrition. This study just said that only about 25% of medical schools even teach the minimum requirement for nutritional education. So, what are we going to do to introduce preventive medicine in a real way to deal with the burden of chronic diseases? Well, we already have an organization and a medical formula for dealing with these things, and it's functional medicine. What is functional medicine? Functional medicine is evidence-based, it's personalized, so it fits our current patient-centric push and good model. And instead of just treating the symptoms of disease, we're assessing and treating the causes of disease. And we're tailoring them to patients, not on a population basis, but on an individual basis, which is much more effective. And we're not only trying to fix their symptoms, we're trying to improve their function. So who cares if the patient's blood pressure is lower if they're still not well enough to go to work or take care of their family? To the right, we have just a diagram of a tree. At the top of the tree is basically what medicine basically deals with currently, which are symptoms and diseases. And at the bottom of the tree is the roots of the tree and the soil of the tree, which is basically lifestyle. So that's diet, exercise, stress reduction, and social support. So we in functional medicine want to focus on the top of the tree, because people need to feel better, but we need to work on the roots of the tree in order to get where we need to go. So in the current model, we basically work from finding out what is your patient's diagnosis. Do they have high blood pressure, diabetes, cancer? And then we prescribe a medication for it. Oh, you have this, so here's your medication. We work mainly to suppress symptoms. So we want to get people to feel better, but we're not really touching on the underlying causes. In the new model, which functional medicine supports, which would be, yes, you have gout, you have psoriasis, you have diabetes, you have high blood pressure. Should we just give you a pill for all those things? No, because they're all related to a condition called metabolic syndrome, which can account for all of those conditions. So we're going to look for and treat the underlying causes of those things. And instead of just using tests to confirm the diagnosis or monitor it, we are going to dig a little deeper and figure out what is causing a person's condition. And we're going to restore function, not just treat symptoms. So I'd like to just take a few minutes and illustrate for you how functional medicine can be applied to one of our biggest chronic diseases, which is diabetes. So I'd like to introduce you to Cheryl, who's a 56-year-old woman who was just diagnosed with diabetes last year. Cheryl comes in with what I would call pretty typical complaints: fatigue, depression, anxiety, knee and back pain, headaches, constipation. If I asked her, she'd probably also say she was having trouble sleeping. And she comes in with the typical group of diagnoses, which is diabetes, high blood pressure, high cholesterol, and she also has sleep apnea, which is currently not being treated. We find out that her dad died of a heart attack, her mom had diabetes, and that she has a high-stress job, just like a lot of us, but I think teachers have more stress than some jobs. She doesn't exercise, and she has a poor social support. She doesn't, her kids aren't at home anymore, and she lives alone, not a lot of interaction with friends. On physical exam, she's very tired looking, she's obese, her body mass index is 34, normal is 25, and her blood pressure is high even though she's taking 3 medicines for it. And as you can see, she's taken a handful of pills. She's got one for cholesterol, 2 for diabetes, 3 for blood pressure, 1 for aspirin, and she takes a multivitamin. This is not unusual. All my patients with diabetes are on all these pills. Now you can imagine if she had a more advanced condition, she might be on one of the newer diabetes medications, which might cost, $500 a month. She's not too happy to pay for her current pills, but at least they're generic. So one of the things we do first, which you might not see at a conventional medicine doctor, is we actually go through, what do you eat for breakfast, lunch, and dinner? And that is very illustrative of what's going on with a person, because if they're not getting good nutrients in and they're eating junk that's poisoning them, then they're not going to do too well. So Cheryl is eating a SAD diet, which is a standard American diet. And it's full of processed foods like instant oatmeal, uh, artificial flavoring in this creamer. She has aspartame in her Diet Coke and processed potato chips. So now that's not Cheryl's fault. Cheryl might have been told that diet soda might help her to not have diabetes or lose weight, and she's been told that bottled water is good for you. But what she didn't know was that aspartame can poison your intestinal microbiome and actually make you get more obese and more diabetes. And she didn't know that the chemicals leaching into her water, like BPA, are going to cause more obesity, hypertension, and diabetes as well. She's been told that red wine is good for your heart, even though I would never recommend that for somebody who had diabetes, hypertension, and all her other conditions. It's even not her fault that she's eating ice cream, because the bacteria in her intestines are set up to love all these carbohydrate foods and not vegetables. And they're basically, every time she doesn't eat carbs and sugar, they cry out, make her feel depressed, and then she eats the ice cream. So if we could break that cycle by changing her diet, she wouldn't have to eat the ice cream. Okay, so when a patient comes in, we order baseline labs. Cheryl has, I'll just summarize it for you, but she has super high blood sugar. Her A1C is 9.9. She has liver inflammation. She has low vitamin D. Her cholesterol doesn't look too bad, but don't forget she's on a drug for that. But her particle sizes are very small of her cholesterol, which is a setup for more advanced clogging of the arteries. We dig a little deeper in functional medicine, and we order tests that have to assess for B vitamin deficiency that she has. She has some mineral deficiencies in key things like magnesium and chromium, which are essential for pancreas function and insulin sensitivity. And she has some problems with high lactate. She has energy production problems. And she has oxidized cholesterol, which is basically like rusty cholesterol that just sticks right to your arteries and clogs them up. She also has deficiencies in fatty acids, key fatty acids like fish oil, and she's eating too many trans fats, which they've now banned from most foods, but you can still get them in a lot of junk food. So we add a few things to her list after our labs. She probably has fatty liver disease, which actually is the main cause of cirrhosis now over alcohol or hepatitis C. And she has low vitamins in D and B vitamins, crucial minerals, and fatty acids. Her energy production is poor, and she has damaged cholesterol. So what do? We organize this in functional medicine, and I won't go through this whole slide, but we keep track of sleep, exercise, nutrition, stress, social relationships, what happened in her life that brought her up to this point, and we organize it not by disease or symptom, but by functional area, like hormones, immune system, and detoxification abilities of the liver and other organs. So I just want to introduce that this isn't only just to help her feel better, it really works. So these are patients who are at high risk for diabetes, for a family history, or they're overweight or whatever, and they compared just lifestyle changes to use of a drug that she's actually on, which is metformin, and have found a delay in the onset of diabetes of much longer for lifestyle versus metformin, and a big cost savings. So if we're going to do this lifestyle changes for Cheryl, we need a different kind of treatment plan than you get normally. And we need to address nutrition, medications, any vitamins and minerals that she might need replaced, and activity, as well as treating her sleep apnea. So we pick a diet with her, and it's a collaboration, and we also have a nutritionist that's part of the team. And we pick a diet that's low in sugar, high nuts, seeds, beans, fresh fruit and vegetables, good sources of protein, and whole grains, which is a healthy diet. I mean, no one's going to argue that's anything unusual. And we're going to replace some things like fish oil, her vitamin D that was low, her vitamin Bs that were low, and give her some fiber for constipation. She agrees to do a treadmill. She didn't want to go to the gym. That's fine. And, you know, she's going to start yoga or meditation or at least deep breathing to help her with stress management. When she comes back in 4 months, she's doing way better. She's totally happy. Her blood pressure is great. Her heart rate is down because she's in better shape. She lost 20 pounds. Her body mass index is down by at least 2. She has more energy. She's not depressed anymore. Her sleep apnea is actually gone, and her headaches and back and neck pain are resolved. So we adjust her plan and have to cut her dose of diabetes medicine in half, which she's happy about. We stop one of her blood pressure pills. We recognize that she wasn't eating enough cruciferous vegetables like Brussels sprouts, which is helpful for detox, so we get her to do that. And she's actually going out more with friends and family because she's feeling better, but she sometimes overeats. So we got her to go for a walk if she does that. And we help her out with some ideas for snacks at work. And then when she comes back at her 9-month visit, her A1C is now below 6, which is basically not diabetes. Her LDL is down, her particle sizes are up, and her liver tests are better. She also has good vitamin D levels. She happens to report she used to get sick all the time with colds, and she hasn't had a cold in 9 months. So we agree that she'll lose more weight, and so we stop her diabetes medicines completely. And she says she's very empowered to continue what she's doing. She doesn't need our help too much anymore. She's going to do it herself. So we have this onslaught of chronic diseases that's going to be affecting us. A big financial problem for the world, the country, the state, the individual. And the good news is that once patients are educated in how they should take care of themselves, they do actually do a pretty good job of it once they've been successful. And this study in The Lancet found that people at risk for type 2 diabetes who changed their lifestyle actually continued it long after the counseling was stopped. So I hope I've introduced you to functional medicine, how it will help deal with our chronic disease burden. So what we need now is to introduce functional medicine somehow into our healthcare system, as far as educating doctors, which they're not going to like, but if we encourage them, they might go back to school like me. And we need to pay more for time the doctors spend with patients instead of paying for expensive pills and treatments. And I hope I can help that happen. Thank you.
Thank you very much, Ken. Again, another very excellent presentation, and thank you to the entire presenter panel here for all of your informative information.